The risk of congenital heart disease with every live birth is approximately 1 in 100 to 1 in 120. That's sort of the rough risk of a congenital heart defect. Actually, the most common congenital defect that there is. It's pretty common. Ebstein's anomaly is like 1 in 200,000, so it's very, very rare. So in any given practice, at least in North America, we know from our national databases that the average number of patients that a surgeon would operate on with this lesion is 1 to 2 a year. That's what the average is. In our practice, we do anywhere from 25 to 40 cases a year. It's a rare anomaly. So that really limits the number of cardiologists and surgeons that actually get into a comfort zone managing the problem, because they're seeing 1 or 2 cases a year. And every one is a little bit different, so there is this great degree of discontent. And the results with surgery have been quite mixed out there. And in fact, they've been poor in some of the reported series. So this creates a situation where there is reservation about referral for surgery by the medical community. Patients and families have great degrees of skepticism. So an example of where this has been effective is an international patient with concerned parents about their child who is beyond the toddler years, 5, 6 years old, who was counseled by their physician that they should not have surgery. The risk of surgery is too high. The benefits of surgery have not been clearly defined, and there was reluctance and, in fact, advice against surgical intervention. So this family goes online to search for information about this stuff and stumbles upon Mayo Clinic, my name, one thing leads to another. It's an email to my secretary and me. It's communication with the Facebook page. We actually were able to get connected with the doctor. And so we actually had the doctor get on the Facebook page and review all of the information. And it was a bit of convincing on our part that there is a role of surgery. And just because his personal experience has been not very favorable with surgery does not mean that surgery should be condemned, that there in fact are programs that have had really very, very good results with objective evidence that in the long term it would be beneficial. And through, across the seas, we've basically had an electronic relationship, if you think about it like that. And this doctor finally came around to agreeing, okay, I'm convinced. And then this family made the decision to come here. This is a few years ago now. And the child has done wonderfully well. And this particular physician has really changed his entire attitude with approach to this problem, and is much more open to surgery, understanding that it just needs to be done in an experienced environment where there's a documented track record, so that he really feels like he's putting his patients in an environment where it's going to be worth their while. And all the sort of correspondence was all via the internet and email and electronic, communication, and it made a huge difference for this child and their family, and it made a huge difference for this doctor who now has a different viewpoint on Ebstein's anomaly.